So I'd like to call the meeting of the Board of Health to order. I have a script that the town likes read at the beginning of the, I've just turned the lights out on me, at the beginning of the meeting. So good afternoon, good evening. It's 7:30. This is an open meeting of the Board of Health being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth and the local state of emergency due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, the Board of Selectmen has suspended all public gatherings in accordance with the governor's order, and all members of public bodies are allowed and encouraged to participate remotely. The governor's order allows public bodies to meet entirely remotely as long as reasonable public access is afforded, and so that the public can follow along with deliberations and board votes of the meeting. Ensuring public access does not ensure public participation. However, we anticipate there will be opportunities for public participation if so desired. And then as a final note, please note as this meeting is being recorded and some people are attending via video conference, and that therefore people may be able to see anything that you broadcast. All right, well, with that, let's begin tonight's agenda. I believe we have a fairly straightforward agenda for tonight, but as always, we begin with a operational update from our health director, and I see Joanne just sent us a note that she lost audio. Are you back on, Joanne? Can you hear us? I'm gonna guess no. Yeah, I was gonna say I'm gonna guess no. You can hear me, Dr. Bill. Is that true?
Yes.
Okay, good. All right. Well, in that case, Ms. Ball, please take it away.
Hi, good evening, everybody. So since our last meeting, we had, we finally got our letter out, and it was definitely a little bit varied from the letter I brought to you. But we did get that out, and if you guys saw the notification, you'll see that the vaccine interest form that we had proposed, that we cut it down significantly. So we decided it would be best and easier to monitor and be able to get into a list that was a little bit shorter. So what we did is we kept the phase 1 bullets for people to choose that if they qualified under that. And then we only added the first 2 bullets in phase 2, which were the 75 plus as well as the 65 plus and the people with 2 comorbidities. So we felt that list would be easier to manage. We sent that out. Within minutes, we had a ton of people sign up. We are currently just shy of 800 people that have signed up on that list. So that's gone really well. We're able to sort the list so we can put just the people who are currently eligible, which is the 75 plus. And we actually use that list at the tail end of our vaccination clinic that we held last week at the senior housing. So just so you know, we're successful in getting 100 doses of vaccine. And I'm not sure you've all heard, but you can typically get extra doses out of the vials. So we were able to vaccinate 118 people with those 10 vials that we received. So that was good. We did it on site at Windsor Green. We did it for the senior housing residents that are 75 plus. There was about 80 of them. And then we had about 20 people that we deployed a mobile unit, which consisted of one of Heather's staff and one of our paramedics, EMTs. And they went throughout the course of the 2 days that we did it on Thursday and Friday, and they went to 20 homes and vaccinated those people. So it was a good little start. Unfortunately, we asked for vaccine again on Monday, which is the protocol. We fill out a survey every Monday. And then we usually hear, towards the end of that week. But unfortunately, this week we did not get any vaccine, as well as many other communities that we reached out to today. So we all seem to be in the same boat. We are going to complete the vaccine survey request again. That's due tomorrow by 5, and we're going to ask for 1,000 doses. Whether we get it or not, we feel we could manage that. We've confirmed that we have the space at the junior high. We will be doing it in the cafeteria of the junior high. We will have the ability for people to park up top. We're planning on getting, transportation to help assist from people from the lower parking lot to the upper parking lot. And it's a little bit of a walk. So people that need assistance will have wheelchairs available as well to bring them to the vaccination portion in the cafeteria. So today, effective today, the governor released additional, he allowed restaurants, close contact, personal services in a lot of gyms, health clubs, library, museums, retails, places of worship, to go from that 25% capacity, which is where we currently were, up to the 40% capacity. So that's effective as of today. In a restaurant, you still have a 90-minute table limit, and employees don't count in those numbers. The governor also announced today, or a couple days ago, that there's going to be a 211 call for residents, current eligible residents, which are the 75 plus population, who are having difficulty scheduling vaccine appointments. They're now going to be able to call this 211 number and get some assistance. So just so you know, when we did ours last week, we had our Council on Aging helping us quite a bit to get some people signed up. We had some of our residents reached out to family members who assisted them, but we were available to help as well. So this 211 call will definitely be instrumental, for people who don't have computers or people that maybe not know how to navigate it. And the website is a little bit harder to get to. So when people reach out to us, we try to send them a direct link, which takes them right to that page. And then they can go forward and try to schedule their appointment. So we did get reached out to from a news channel, which you guys probably all saw, asking about vaccine deserts, he was calling them. So what he was asking about was, if you look at Acton on the map, there's, a fairly large area around Acton that does not currently have vaccination sites. So I think I told you at the last meeting, we did have a conversation with the 2 CVSs who are currently working on being a vaccination site. We hope to continue to be a vaccination site. And then I did go on today just to see where we were at with, trying to get an appointment. And it looked like there was some at Fenway and Gillette, but I didn't have a lot of luck looking at some of the other areas. So currently the ones closest to us with, if you type in, a new thing you can do now is add your zip code. And just when I did that today, I added the zip code and then I said within 10 miles, it said no records found. So when I upped it to 20 miles, it gave me an option of Fenway Marlborough Hospital, Burlington Wegmans, and Wayland CVS. So just so you know, it's still a little bit of a lull there, but we are trying to change that. We hope we're successful in getting a large quantity of vaccine. We feel comfortable that we can vaccinate about 500 people a day. So that's where we're at with that. We had that WR Grace meeting this week, and I know some of you joined. So basically the meeting was just the current status of where WR Grace is with remediation, how it's ongoing, and that they talked a bit about the proposed solar array, which is going to take up about 30 acres of that site. The landfill is currently capped, and the activity and use limitation will be recorded on that deed, and it would prevent disturbance of that particular area. So I'm working on getting those slides. I've asked for them. I don't know if they will send them to us, but I would be happy to forward you those slides that were talked about at the meeting. They basically show two other areas that they're asking, that they're showing that there may be future development on those areas. So there was a lot of question and answer. The conversation was about 45 minutes, and then the question and answers was over an hour. So like I said, hopefully I can get that information and I'll get that off to you. But that's all I have.
All right. Thank you very much, Cheryl. Members of the board, any questions for the director? Dr. Taylor, you're unmuted, but I'm going to guess that's just okay.
I'm always unmuted.
That's right. There's no muting you. Anyone else? Mr. Conaby.
Yeah, Cheryl, you said you requested 1,000 vaccines, and what did you say the population of phase 2 folks over 65 and those with 2 comorbidities in town is?
I don't know what the population is of the 2 comorbidities. I do know that there's about 1,300 75 plus residents. So right now I think we have 350 or so, 380 on the on our current vaccine interest form that qualify for the 75 plus.
Do you have any guess of when you might hear from the state and what type of allotment they may provide?
Typically, when we receive the vaccine the previous week, I think we knew by the end of the week. So it's, like I said, it's due by 5 tomorrow, and I suspect we would hear by, the week, Friday or possibly even Saturday of the same week.
Have they committed to providing the second doses for those that just received the first dose? Do you know?
So they've indicated that that's a top priority, and it's only speculation as to why cities and towns didn't receive vaccines this week, but we do wonder if it's because we're coming up on this week is a second dose for a lot of our first responders, and the next week as well. So those, we had teamed, as we teamed with the Neshoba Board of Health for that. So that request would be coming from the Neshoba Board of Health to finish the second dose for our first responders.
Mr. Cruz, I think you may have had a question, or did it already get answered?
Cheryl, is it just the Moderna that you can dose?
Currently, yes.
Okay. Okay. Thank you.
Okay. Any other questions for Ms. York? All right. Well, if there are none, then typically we move on in this point of the agenda to get an update from our nursing service director, Heather York. Heather, would you please bring us up to date?
Hi, good evening, everyone. It's nice to see you. So as Cheryl said, we're happy to get at least a very small amount of vaccine and get started with doing some residents in town, especially those most at risk in the stage 2, phase 1 bracket of 75 and above. So that went really well. Deputy Chief Anita Arnhem, who is our emergency management director, is running in charge of doing the clinics, and she did a great job. It went really well. As Cheryl said, not only did we have a large number on the interest list, but we also had quite a few additional volunteers sign up to assist with clinics, including a lot of our town employees. So that has been added to the MRC list, which makes us feel comfortable doing a larger clinic. So that's good news. The numbers as of tonight are overall since March, 709 COVID positive cases. There's currently 23 in isolation. So that number has dropped significantly in the past couple of weeks, which is good news as the state numbers are going down. 655 recovered and 31 fatalities since March. So that's one additional in the last couple of weeks, unfortunately. Robbinsbrook, I had heard, Benchmark, the Inn at Robbinsbrook, they started their vaccinations on the 27th. So their residents and employees, I believe it was about 138 in total, were vaccinated on the 27th of January. So their second dose will be due at the end of the month. So that's good news. As we discussed before, Life Care Center of Acton had completed so they did 4 clinics and vaccinated their staff and residents also. So that's really good news for those 2 congregate care facilities in Acton. Trends continue with household transmission. We are seeing quite a few households that every member of the family now is eventually turning to a positive case, which is hard for people, especially with larger families, as each additional positive case is found out in the home. The quarantine for everyone else within the home gets extended farther and farther. So it has been a challenge for some of the bigger households in town, unfortunately. Working still closely with the schools, as they've had quite a number of students in the last 3 to 4 weeks, most especially, that are now testing positive with family members. So that has definitely been adding, definitely to their monitoring over at the school. Hockey has been an issue again in the last few weeks since they restarted after the holidays. Unfortunately, I know Cheryl and I have been concerned about that, but also with football starting up for some of the school and outside teams. So that's a concern for us. Basically just business as usual with contact tracing. But, as Cheryl spoke about, the 75 and above having some challenges with signing up for clinics. I know it's definitely been hard for residents of Acton to actually find open appointments, as Cheryl discussed. The good news is I did hear today that Emerson Hospital has started to do their doctor's offices patients. So that's good news for our residents who do have a primary care that is affiliated with Emerson Hospital. And I know some of the other hospital groups have been sending lists and letters out the last, month or so, and have started to identify their 75 plus beginning last week. So if you have a PCP outside of the Emerson system, other hospitals such as Leahy, the Brigham, et cetera, are reaching out to their 75 plus to get those folks vaccinated. So we'll get there. It's, slow moving, unfortunately.
Okay. Well, yeah. And unfortunately, there doesn't seem to be a lot of predictability, which, it would certainly help if you could have predictability that says you'll get this many doses on this date, and then you could plan for that. But I just had a couple of quick questions. Heather, I'm just curious. There are news reports of congregate care facilities having slow uptake, particularly among the staff of the vaccine. What's the experience been in the congregate care facilities in Acton? Have the staff been, willing to get vaccinated, or about the same as the news reports, half?
Well, no, I think we're actually better than half. When I had spoken with Chris Foy from from Life Care, he originally said they had about 95% of their staff that was vaccinated. There was a small percentage that chose not to be vaccinated. For Robbinsbrook, I would have to find out from Carrie LeBlanc. I believe employees, the total number of employees was 60 as of that clinic on January 27th. I'm not sure of the percentage as opposed to as in turn of their staff members, but I could definitely find that out.
Okay, well, like I say, it's more of a just, it would be concerning if it was not being widely adapted by the healthcare workers because they obviously have the contact with the patients. Well, different question.
Agreed.
Yeah, and anything we can do, of course, to encourage that, but I guess we can't mandate it. Different question, which is just thinking again about the logistics. I believe the town gets the vaccine free from the federal government. Is that correct?
Correct.
So how is the staff? Do we charge, someone for the administration, or is that 100% borne by the town?
So the prep mod system, which Cheryl and I have talked about in the past that we were trained on to use for the clinics, that's the booking system that the state is using for all of the clinics within the state. That hooks up directly with a UMass partner who does the direct billing for the administrative fees. So as an example, our clinics, you booked online for the vaccine that was received from the federal government. Once we close our clinic, that gets uploaded to the Mass Immunization Information System, the MIIS system, which in turn then goes off to the UMass folks for billing the administrative costs to insurance.
And then are those funds remitted to the town?
Yes.
And so because inquiring minds want to know, what do we get per administration?
So there's different amounts. Cheryl actually forwarded me an email that I did not see, and it looks to be anywhere from somewhere between $35 and $50 up to $90. And it really, I think, depends on the vaccine, whether it's the Pfizer or the Moderna, or your insurance, which is pretty typical for vaccine administration.
So when people register on the prep mod system, they put in their insurance information.
Correct.
I see. Well, this isn't necessarily a Board of Health thing other than just we try to make sure that the nursing service is adequately resourced. Mr. Martin, do you know if those funds are being put in the Nursing Service Enterprise Fund or otherwise distributed?
I don't know.
No, it wouldn't be. We don't have an enterprise fund anymore. It goes directly to the town in general, to the general fund. So that would cover the cost of the administration, any supplies that aren't given directly from the ancillary kit that comes with the vaccine, and then any staffing, things like that.
Okay. All right. Well, thank you.
Mm-hmm.
Did you? Okay. Ms. Becerra, I see that you've patiently been waiting unmuted. Did you have a question for Heather?
Yes, thank you. Good evening, Heather. You mentioned earlier that patients who are 75 plus and have doctors affiliated with Emerson can get immunizations that way. So does that include physicians at Acton Medical, or is that a separate entity regarding vaccinations?
So Acton Medical, I know, does have vaccine. I don't know the amount. I would assume they could go to either, dependent on the availability, but I don't know that for sure, honestly.
Okay, so this person I'm thinking of should contact their PCP to
Yes,
find
absolutely.
out the best way to go about it. Okay. Thank you.
Sure.
Okay. Other questions from members of the board? Mr. Cruz.
Thanks, Bill. Heather, thank you very much for your service and dialing into these meetings. I did help out for a week on site at Pfizer in Andover, and we were able to vaccinate quite a few people on site, the essential workers. If you need help with any vaccine clinics, please reach out. The second question I had, or second comment question, is what is the uptake for town essential employees that would be the first responders in phase 1?
So thank you for your offer to assist. That's always helpful. I'm sure that we have the volunteer list that you can input your information so that Deputy Chief Arnhem will have that. Your second question, was it on the uptick of first responders when they're due for vaccine? Is that what you were asking? I'm sorry.
Sorry, the uptake for fire and police. I think they were phase 1, and like there was a question from a meeting or two ago about how many were signed up.
So I don't know the answer to that, unfortunately. And I know that Cheryl has tried to get definite numbers, and there's been some privacy concerns by some of the members. I can tell you that my staff has all been vaccinated their first dose with the Neshoba Associated Board of Health. I have a few that were vaccinated prior to that when it was open to COVID-facing healthcare, as I have a couple of folks that do facility-based care also.
Thanks, Heather. Cheryl, do you have an idea of police and fire, what the percentage is who have gotten the vaccine?
Mike, I don't have the percentages, but police is very high percentage. And fire, I've been working since even prior to the last meeting, and they just don't want to tell even their supervisors whether or not they received the vaccine. So they're claiming privacy issues, as Heather mentioned. So I don't have a number for the fire.
Oh, Bill or Mark, is metadata like that a privacy concern?
So Mark obviously is more qualified to answer than me, but I can just tell you from what I know in the business world, I believe it's the Equal Opportunity Employment Commission has ruled that in fact, that's not protected health data. So for example, you can exclude kids from school if they don't have the proper vaccines. So vaccination status is not considered medical information, apparently. And as a consequence, there isn't a right to protected medical information on vaccine status. And in fact, the ruling that I read about from the federal government was you can make it a job requirement that you be vaccinated in order to hold certain jobs, that wouldn't be discrimination in employment. So, but that would be something for town council, obviously, to explore, I would assume, if they wish.
I'm not sure that's totally accurate, Bill. I think for the schools, there's school immunization laws. So it does require them to be excluded, but only if there's an outbreak. I think others, it's not, they're not going to tell you. It's personal. You can't go into the records and determine who they are. And interestingly, nursing home workers are not mandated to get vaccination. They can turn them down. And most nursing homes, the staff is getting about 50%. I think the residents somewhere from 70 to 90.
I hear what you're saying, Dr. Bill, and I mean, I agree with you. That's why I asked the question about what our experience in Acton is. because
Yeah,
I had heard the same thing. But and the nursing homes may choose not to make it a requirement. I think what I was understanding was that they could make a
I'm not
requirement.
sure that they can.
That's a separate issue, Bill.
Yeah.
There's a difference between a governmental requirement and a private employer requirement. But
Okay,
as far as the ruling, you're correct about what the EEOC had said about that. And there is certainly case law in Massachusetts on this situation. But you could obviously mandate it as a public health. You could also entice it by providing benefits, or you could, as Bill said, restrict it. So those who do not report it would not be available to have certain other benefits, such as not being able to do certain tasks or not be able to have overtime or things like those type of situations, or you could provide, as some other employers have had, free time off, certain rewards, additional vacation time, additional sick days. So, I mean, there's a whole bunch of different options that have been proposed, but it is an HR question. And I do think we had asked whether the town wanted to mandate it. And I believe we had been reported they did not make it mandatory, but certainly providing that information is critical. And I think it's a very important metric to present to the public to show how important it is and lead in a public health perspective. So I think would definitely be worth getting that information and looking at the options. And Bill, as you said, getting an opinion from town council of what the specific
I think in
options
the,
are would be an appropriate step.
I think in the nursing home, however, where there's a shortage of nurse aides, if you mandated a nursing home, you might lose half your staff and you wouldn't be able to replace them. So,
It's interesting. I mean, in all the congregate care settings, they're running into a number of these issues. I'm seeing it, both in the residential area and the some of the other group homes and things. There certainly is a resistant population, but there's also a lot of them who are very willing and are very pleased to get that opportunity. And there are a certain number of them that are providing incentives to try to encourage the staff to do it. So it's kind of a different situation. I think it also varies by the area. I think Massachusetts seems to have more folks that are willing, but there's certain other areas of the country which are less receptive to the vaccination program. So you're right. There are certainly a lot of issues to it, but if we can provide that information, that opportunity, and provide it for a public health perspective, I think we definitely need to encourage it as much as possible.
Okay. Well, thank you, both of you. I'll just offer, I did see in this, I am sure of Kroger, the grocery store chain, has offered their employees $100 if they are willing to get vaccinated. So they get a $100 bonus. So there are some incentives, I guess, that are being offered by some places. I guess maybe this is something that we should probably keep an eye on, is maybe the best way to put it.
Yeah, Bill, I'm wondering if, like, if the board wants to, of the staff populations, Heather noted that like 100% of her staff is got the vaccine, but if we can get aggregate data for the other eligible group, fire and police, for a future meeting, I think that would be a good idea. I mean, if it's one or two people that are holding out, I think that's different from, 50%.
Well, I think what Cheryl is saying, Mike, is that she can't get the data because people won't tell you. And they didn't have to come to Acton to get vaccinated. Some apparently went to other sites in the state to get their vaccine doses.
Yeah,
So,
Bill, I think there is a state clearinghouse for that data. No?
yeah, the prep mod, right? But
Yeah.
I don't know that we can go pull individual records. I don't know. Can we? Heather or Cheryl?
I mean, possibly. It was not our clinic, so I'm not sure if we can. I can look into that if you'd like.
Well, it's slightly broader than that because people that attended a clinic elsewhere, right? You'd want to be able to get their status as well. I think that's what Mike is saying. Is there's a central database? Do we have access to it? And
I'm not 100% sure, but I know we have access to our clinic data. I don't know if we have access to other clinics' data. I can find out though.
Yeah, I guess my point is these are public-facing individuals that are employed by the town, and if I think it's a good idea.
I mean,
You
we
know,
don't, the thing is we don't know, right? I mean, it could be, we could already be at 100%, right? And they just don't want to tell me that information. I don't know though. So I'll see what I can find out.
Question, how are we going to be going forward if we have first responders who encounter residents or persons who are positive and they've been vaccinated and had both doses in the time period? How is that going to affect the time required for quarantine and some of the reporting? Do you have any guidance on that so far?
So I have not seen that guidance. I'm not sure if Cheryl has pertaining to vaccination. I do know that as a healthcare personnel, if you are positive and it is within a 90-day period of your recovery, you do not have to quarantine if you are identified as a contact again. You are suggested, if you do start to show symptoms in that 90 days, that you are suggested to get tested, but they typically are not telling you to quarantine. The travel guidance is listed exactly the same on the state website too, for anyone that has tested positive and recovered in the last 90 days. They do not have to have a negative test to come back into Massachusetts, but they still have to fill out that form.
Dr. Bill?
However, when people don't know much about the pandemic and the risk, we're recommending that everyone gets immunized, even those that have had COVID. That doesn't make a lot of sense. So I would
Well,
assume once you're vaccinated, you'll be treated as if you can't get the disease.
I would assume, but that guidance hasn't been released that I have seen.
Yeah, I agree, it hasn't.
Okay. Well, I think what Mr. Cruz said, and I would certainly agree with, is it would be helpful if we understood the status of the first responders in town, even if they have to do it by some sort of anonymous survey or something. It would be helpful to understand that, and I think it's that's a reasonable thing to be able to present to the people in town, that 90% of the police and fire are vaccinated, or whatever the correct number is.
yeah, and Bill, I guess if the response is, hey, only 40% have gotten the vaccine, I think it would be good to understand why. Are they, is there a medical reason behind it, which it would be legitimate, or, are they just scared of getting a shot, or, I don't know what it is. Maybe there would be more outreach that is necessary, but, I think this is a public health concern. The vaccine manufacturers, I can speak, from personal level, we've been working very hard, a lot of hours, weekends and evenings, to get this approved with the EUA in a very expedited fashion. And if people are just cavalier about this, I am concerned about it.
Okay. Well, I think it's certainly more of a case where, we want to make sure that so one things I understand with the contact tracing, and Heather, you can help me here, but I believe, the police and fire get access to the households that have active COVID cases, so that they know if there's a call for emergency services at those locations, that the responders need to take the appropriate care. And one answer to that could certainly be to send vaccinated individuals to those addresses that have active COVID cases. It seems to me that would be reasonable. So that would imply that you'd need to know who you had as vaccinated first responders. So, I mean, there is a public health and service delivery reason for the information. It's not just curiosity. And if we're going to be in a situation where there aren't enough vaccinated first responders, either firefighters or police, such that you could have shifts where there was no one available, then we should know that too. And then that might be a case where the board and the town would want to have a discussion about how we maybe remedy that. So, Cheryl, dropping this in your lap, is that something that you can have a discussion with your counterparts in the town staff and see what might be able to be ascertained?
I can do it. I can do that. I know I have the numbers for police. I just have to figure out the percentage.
Okay. All right. Further questions or comments from members of the board? Any comments from members of the public or members
Bill?
of the select board? Mr. Conaby.
I think it would be good to get a little bit of additional support from the town manager and the select board. And it might also be worth inviting the emergency coordinator to the next meeting if they want to discuss this issue as well.
I don't disagree with what you're saying, Mark. I was just going, and I guess I'll say more baby steps, because if Cheryl comes back and says, well, it's 95 and 95%, then we can probably.
No, absolutely. And I think you also need to clarify if there are certain individuals that have medical or religious exemptions that certainly should be counted towards the percentage of compliance. But obviously you need to also take that into consideration, as you said, in delivery of the public services within the community.
Right. So I was just suggesting that we let the data guide our next steps, I guess. And but your proposed approach sounds very reasonable if turns out we do have a problem. So I'm sorry, back to, are there any comments from members of the public, Cheryl? Questions? No? Okay, do we have any public?
We do. We have 5.
Excellent. All right, well, in that case, if there's no other discussion, I believe we can move to the next item on the agenda, which is, if my memory serves, I'd have to switch screens here. But I think it's
Article 11.
proposed changes.
Yeah. Can you guys see my screen?
We can.
Wow, that was pretty good. And I didn't even need Mr. Martin's help.
I know.
Okay, so I went back. We had discussed this, I think, back in the end of November. And you guys had made some suggestions. And I went through the meeting notes and I made the changes that you suggested. I hope I got them all. So I'm bringing this back before, because you had asked that I make the changes and bring it back again. And I'd like to schedule this for public hearing unless there's a lot of concern still tonight. If you recall, the yellow was the proposed that we had asked at the last meeting. And then I've gone through, and I'll go back to that in a minute, but I've gone through and I've put the changes that I thought you were asking for at the meeting in blue. So if you see the blue here, that's the new language I added. But let's just go back to the start and make sure that we've got everything here. So this is what I have. I didn't hear comments on this, so I just kept these as is. I don't know how you want to go through it, Bill.
I think the way you're doing it is fine. Just I think you can sort of hit the highlights. Well, here are some proposed changes. Any comments? And just
Okay.
kind of keep scrolling.
All right, all right. So there was no comments on these two on the first, so speak now if you have any comments on these.
I think we're good.
All right, so now this one, if you remember, I had put the number wrong here, so that's why I've got the 5 in blue to show you that I changed the 5. No comments on this. Whoops, getting a little crazy here. So this one, let me just get this out of my way here. So this one, we had talked about this at length, and I hope I incorporated the changes that you were looking for, but we talked about, potentially having one tank at 1,000, maybe having to put in a pump chamber, adding the extra 500 with another tank. So I added the language, second tank in series to obtain the minimum of 1,500. I don't know if anybody has any comments about this one.
Sure. Can you add gallons after 1,500?
Yeah.
And I'm going to suggest you've got the language, unless an alternative is approved by the board or its agent. We have a variance procedure, so I think it just gets kind of worried to put that in through every different section. So probably just simple 15 gallons or 2,000 gallons, obtainment of 1,500 gallons.
Well, so Mark, I think the reason for this particular choice of language is so that it wouldn't have to go through a variance procedure if Evan or Cheryl or just wish to allow an alternative.
All right, then maybe just unless
I think you're
unless otherwise approved by the health department or its agent.
fine. And I think you were pointing out that the word should be an, not
Correct.
Yeah. Okay.
But I think we should track the same language all the way through it. But I guess we have variances. If there's a bunch of them, we can delegate it to the department. I really don't think you need to put it in each different section. I think probably it's kind of just redundant, and keeping it simpler might be better.
Well, if it applies to everything that's in this section, you could just put it at the beginning of the section. Any provision in this section
Well, it's the bottom, the variance. It's like any provision can be. I have to scroll down wherever it is.
Well, I don't think we want to allow agent to vary any provision of this regulation, right? I don't think that was the board's pleasure.
No, but in the variance section 1114.1, the Board of Health may vary the application and provisions with respect to any particular case. But we've delegated to the department to do certain actions before, so I think that would cover it.
Okay, if there's a delegation letter or order or whatever.
Yeah, we've done it at other meetings where 6 inches of stone and a bunch of different ones. And
yeah, you're right. That's separate from the regulation. It probably should be in the regulation, right? Somewhere.
Yeah.
So I just want to make sure I'm clear. So you want it stricken from these 3?
I'm suggesting that maybe just instead of putting the languages there, is just not having to put the variance, or you can, the alternative, you really want unless otherwise approved by the Board of Health or its agent. But that's a variance either way. So I don't really think that it makes sense to put that language in there.
All right, so you want me to, after second tank in series, to obtain a minimum of 1,500 gallons, period?
Minimum capacity, 1,500 gallons capacity, period.
Okay.
That was,
And then, yeah, that's okay. And then the next one, dual compartment tanks are required for all system designs, period?
For all new septic system designs.
He's suggesting that any language that begins with unless be
Right.
stricken.
Okay, I just wanted to make sure.
We can do it either way. I was just going to go to the next one. Monolithic tanks and pump chambers for all new tank installs. Shouldn't that be installations? Picky.
Okay,
All right. I guess I wanted to just get people's thoughts. I mean, maybe we can have a section in the variances where we can add language, delegating it to the department. But if you do it at board action, I think that should be adequate.
Yeah, either way works. I mean, I think it'd be less confusing anyone trying to read the reg and figure out what to do. And, I was just going to say in 11-7.9 says any provision of this section may be varied by the Board of Health or its agent or something like that. Just so that someone who reads it knows that Evan can in fact say, well, I propose that you, whatever the proposal would be, and that could be acceptable. Wouldn't require them to come to the board for a variance.
Yeah, but I guess that kind of defeats the whole purpose of why you want to have a regulation that's consistent.
the feedback for these, like I said, we've been, if you remember back in November, we've kind of taken it upon ourselves to ask for these already, and we're not getting any pushback. So I don't suspect that we will. So I'm fine with taking out those sentences. And I feel like it's just giving us the actual regulation to ask for the dual compartment tank, the monolithic tank, and to make sure that they have 1,500 gallons. That's pretty much the whole point behind this language.
Okay. All right. Well, I guess either way gets us there. I mean, I agree with Mark. It was a little repetitive. I didn't really struggle with it being repetitive, but it could be cleaner if we just state the regulation and then leave the variance to somewhere else in the document.
So should I put in the 11.7.9 with the language that you said, or just leave it out?
Well, my personal thought is that, we should let someone who's reading the regulation understand, that there shouldn't be a separate, not attached delegation of authority, because the idea is to convey, the full story to people that are taking the time to read the regulation.
If you put it just once, it's not going to be that big a deal. So, I mean, just adding it in there should not be a big deal. Basically, but you have to decide whether you want to call it a variance or what, it probably would be best to say that it is a variance because these are the requirements and this is varying from that requirement.
Okay. Anybody else have any comments on this section? All right. So we're gonna go down.
So this one I remember
So this
is
was
actually,
again,
yeah, this was based on actual experience, right? Where we had one system where it was in fact settling.
correct.
Yeah.
And since then, we've kind of, as a policy, been asking for this already, and again, with no pushback, so.
I guess just in that particular case, just unless an appropriate alternative design. So because it's just not an alternative. It's it has to be designed and by the engineer.
Okay. Any other comments on this section? Okay. So this one I struggled with a little bit. There was no changes from our conversation to two of them, but there was one with the water softener reverse osmosis system. So I hope I got the language that you all wanted, but I may need some help with this.
Looked okay to me.
Okay. Anybody else?
What's concentrated wastewater?
So I think what we're trying to say here is that there's some systems that don't put the quantity of water back into the septic, and this is basically saying that you can't have a system that puts the water back into the system. That's how I interpret it. But Mark, I don't know. Did I explain that right?
Pretty much. Instead of maybe reject, RO reverse osmosis systems that reject, basically, they reject concentrated water that discharge to should not be allowed to discharge into septic systems, because they, I think that's really the point. What the RO systems are is that you have a membrane, you apply a pressure, and presumably you have a certain amount that can pass through that membrane, the pores, and that's their product. And then what isn't has concentrated constituents, and that's, typically either, has to be discharged, or it has to be recycled, or has to be used for an alternative use. So the point is that if you have 50 to 75% of the wastewater the water being rejected and going there, it can be a fairly large source, and it can provide a lot of loading and issues with the septic system. So I think that was the point, but I don't think there's many residential water systems that actually use that type of system rather than just a cartridge type unit. But that's obviously the intention, is to prevent these, water sources from inundating the septic system.
Correct. Any other comments on this section?
I'm not sure Dr. Jacoby got his question answered, which is
Ah.
basically when you have water and it's got contaminants in the water, equally distributed throughout the water, and you run this filter, it effectively pushes the contaminants to one side, right? So that now instead of having 1 gallon of contaminated water, you have half a gallon of pure water and half a gallon of doubly contaminated water. And it's the doubly contaminated water that we're talking about, not putting that into the septic system, because it loads the septic system with a lot of water. And second, it's concentrated, contaminated water. So usually,
But we're starting generally with drinking water. So there's really not that many contaminants. It really is just
we
the
hope.
water source. Yeah,
Yeah.
presumably. But maybe with a well water or something, you might have a greater need. But that's a whole separate issue. But yeah, you're right. I mean, you're basically taking that water and forcing it through a membrane, and you're getting two streams: a concentrated stream and a purified stream.
What do you do with the concentrated stream?
Well, that's a good question. You have a few options. You can reuse the water for things like cooling towers, or toilet flushing, or irrigation, or you can discharge it to storm, are the most typical. But that is a vexing problem in the commercial industrial, particularly for like laboratories that use a lot of water. What do you do with the reject? And you generally need a system and a plan to deal with it. It's a fairly complicated and important aspect to having these RO systems.
Okay. Thank you.
Okay. All right. Are we ready to move on? Or?
We are.
So I don't have anything else with Article 11. I'll stop the share, make sure we don't have any questions. I do have one hand raised. Do you want me to call on?
Please.
So Kim Castens, I'm going to allow you to talk. Should be able to unmute yourself, Kim.
Okay, I wanted to comment on the reverse osmosis systems. This did come to be an issue with respect to drinking water with PFAS. So since Mass DEP has set a maximum contaminant level for PFAS, people have been interested in putting in treatment systems, and there are underneath the sink, and there are also whole house reverse osmosis systems. And so the problem with the PFAS is that you're putting it back into the aquifer if you put it into your, if you put the so-called reject water into your septic system, then it goes back into the aquifer. So that's why the Mass DEP began to pay particular attention to this reverse osmosis system issue last fall in October when they put in the MCL for PFAS.
Did they, thank you, that's good points. Did they have any suggestions what you do with the reject water?
They said don't use a reverse osmosis system, use an activated carbon system instead.
Well, okay. And then what do you do with the charcoal, activated carbon when it needs to be refreshed?
That's a different problem. It doesn't, yeah, it has to be disposed of, but it doesn't go into the aquifer. So that's what they were concerned with. So yes, PFAS is not a simple problem.
Indeed. Well, yeah, I don't have a good answer of it. It's certainly not contemplated in our regulation as to what to do with the reject water.
Well, what you've suggested here is aligned with what Mass DEP is now requiring. So what you've written here makes sense and is compatible with what the state is asking for.
Excellent. Well, we were ahead of our time and didn't know it.
Is that still true if they're directing it to the storm sewers?
Bill, I think obviously it's going to be reintroduced in most cases for the sanitary, or if it's going to storm. The point is you're trying not to dilute all of your waste for your waste treatment, and that's why. But the RO, most of the residential units are not creating a concentrated wastewater. Most of them are a membrane which just traps it. They don't have, how should I phrase it, a certain amount of reject wastewater to the two streams. They're more of a kind of a RO. It's a size membrane for the particle size rather than being a typical high pressure reverse osmosis commercial system. We could run into that issue where some people are using large amounts of reverse osmosis water for certain applications, particularly like cooling towers and for makeup of high purity water for certain applications. But I think those are kind of a unique situation. For what we're talking about, I think that this should be adequate in the sense that we're providing protection for this septic system. And that's really the primary goal of this article.
Okay, very good. Thank you. Ms. Castens, thank you for your comment. You sound like you're very knowledgeable on this subject. I hope you you are willing to attend future meetings. We could use your expertise.
I wrote about this for the Green Acton website.
Ah, okay.
So if there's several PFAS articles on the Green Acton website, which I wrote. So I did struggle with this whole reverse osmosis question and did have some correspondence with the people at Mass DEP about it.
Excellent. Well, great. Well, thank you. All right. Well, I think, Charlotte, I think that one's probably ready for a hearing.
Okay,
And we got one more.
I do.
This one, if I remember, is shorter.
It is. There was only a couple here. So this one, we actually talked about lowering and increasing some of the numbers here. So the nitrate loading assessment, we talked about bringing that down to 1,000 from 2,000. And we talked about increasing the gallons per day to 660. And then on this one, we talked about lowering the 10,000 gallons to 5,000 gallons per day for treatment plants. So We didn't have a lot of discussion on this, but we did discuss that. Anybody have any thought, any other, did I capture everything right? And is there any other questions about this?
Question,
Seems to-
Cheryl?
Yeah,
Going back to the 660 gallons per day.
Yeah.
That would be, I'm just wondering, it should be greater than 660 rather than 660, because that would mean if you had a duplex with 2-3 bedrooms, it would require the wells.
okay, I can add
I don't
that.
know. I mean, I'm just capacity greater than 660 gallons a day. That would allow up
Six.
to 6 bedrooms. You know,
That's a good point. And, you know, so you're saying that if it was 661, then they'd have to,
right.
yeah, okay.
I'm just thinking, you know, certainly 5 bedroom, but I'm thinking we have a number of cases where you might have, you know, 12 plus. I mean, you start running into, you know, larger houses that have more total rooms, then all of a sudden you have a higher design flow or whatever. I mean, just putting in wells. I don't know what your thoughts are on that, whether it should just, how many cases you actually see and what would be an appropriate point to require them.
I think you bring up a good point. I like it greater than 660. Anybody
Okay.
else? Okay, so moving on, I think we talked about yeah, I brought that down. All right, and then this one, we brought this down from 1,000 to 660. And this would be for permits that could be granted by our department. Anybody have any comments about this?
Again, do you want to make it, so that would be a 5-bedroom design. Do you want to make it so it would be 6, or you don't think you need to? I mean, it's probably not very often you'll see it, so I don't know if it makes any difference.
Yeah, I mean, in 16.6.1.1, I can see putting the greater than, but the other one, we're specifically saying less than 6 bedrooms. So I think I'm fine with that one, but I can add greater than on 16.6.1.1. Okay.
You already have it. It already says exceed.
Oh, will not exceed.
Yeah.
Okay, so I guess I'm fine with the way those are written unless you have angst about that, Mark.
No, I just, with a flow of, when 16.6.1 with a flow up to 660 gallons instead of less than, that would be a consistent, but whatever.
Okay. Up to 660 gallons per day.
Yeah.
Okay. So I'll change that language to be the same in here too.
Yeah, just keep them both consistent would be my suggestion.
Okay. And I think that's it.
Yeah, that's it.
That was quick. That was an easy one. Anybody have any other comments on that?
Nope.
Looks good.
Any comments from members of the public?
Sorry, I have to stop share so I can see. No, I don't have any.
Very good. All right, well, we can probably address those at a future meeting then and promulgate them.
Okay, great. Thank you.
All right, I believe that brings us to the minutes on the agenda. Is that what you have, Cheryl?
That's correct.
And I did read the minutes this time. You just have one small typo in the paragraph that begins about the firefighters vaccination clinic. And I'd have to swap my screen here. Sorry, it's when it says the first responder vaccinations, it says Ms. Ball stated that we completed.
Okay,
Pick one.
okay.
And other than that, I had no comments. Any other comments on the minutes? Appears there are no comments on the minutes. Would a member care to motion to approve the minutes?
Yeah, I'll make the motion to approve the minutes.
Thank you, Dr. Bill. And is there a second?
I will second them.
Thank you, Ms. Becerra. We have a motion made and seconded to accept the minutes with one correction as noted. Further discussion? In that case, all those in favor, I'll start with you, Dr. Bill.
I'll say aye.
Ms. Becerra,
Aye.
Mr. Cruz,
Aye.
Mr. Conaby,
Aye.
and I also vote aye. Motion carries unanimously.
So I do have, looks like somebody raised their hand, and I don't know if they raised it a little bit late after the last discussion or if it was prior to this one, but do you want me to call on them or?
Sure.
Alyssa, I'm gonna state your name and I'm gonna allow you to talk.
You need to unmute. There you go.
Hi, thank you. This is Alyssa Nickel. I am on School Street in South Acton. I did not get my hand raised quick enough. Sorry about that. So I just wanted to ask a couple of questions about those proposed changes. You mentioned that one of them was proposed because of one experience with a system that was settling. And I was just wondering if you could comment. My first question was where the proposed changes came from. Were they all experiences or were there changes in regulations at the state level? Just wondering what prompted the changes to these regs.
Do you want me to do that?
Yeah, I was going to say you're probably. I mean, it's a variety of factors is the causation, but maybe Cheryl could just run it down quickly.
So I'm not aware that the state's changed that reg yet, but I do know that throughout the state, there has been issues with some of these chambers settling. And by requiring that geogrid to be placed underneath the chambers, it prevents them from settling. So what happens is it gets compacted and then the chamber doesn't accept the water because it's been filled with the sand underneath. So that's the whole reason. And we're not the only community that's experiencing that.
And she was asking like some of the like tank sizes, and I believe I'm putting words in your mouth, Ms. Nicole.
Yeah, I'm just wondering about, there were many changes and I'm just wondering, that was one example, but what's the overall prompting for so many of these regs to be altered? And exactly the tank size and.
So we as the department, as far as the tank size has been 1,500 gallons from the state of Massachusetts since at least 1995. What we're asking for is people that have a smaller tank size than that. Currently, when they're replacing their systems, if that tank size, if the 1,000-gallon tank size passes Title V inspection, it is allowed to stay. So we're hearing a lot of pushback from people purchasing homes thinking they've purchased a brand new septic, and ultimately what they purchased is a brand new D-box and leaching area with a 50-year-old tank. So that's part of the reason for that. The other parts are the monolithic. We believe, monolithic in most cases, you can buy a tank that's completely set. We do see over time that where tanks are put together with the seam, they leak. So it prevents that. And then trying to remember what the other one was, monolithic. Oh, and 2-compartment. We just believe that 2-compartment, when you're flushing your septic, and the water, the clear water is supposed to go out into your leaching field, and this solid settle. So with 2 compartments, it's a little extra precaution. So before, let's say you don't get your tank pumped, the first chamber fills up, the solids start flowing into the second chamber. And then, someone goes, it's been a while since we've had it pumped. You get it pumped. That second chamber would stop those solids from entering your leaching area and clogging that system and ultimately failing it. So for, pretty easy, it's a more of a clarification. As I mentioned earlier, it's something we've been requiring for quite a few years now. And all engineers know that we expect that. And it's like I said, it's more for protection for homeowners. Did I get everything?
Yeah, so it sounds like a lot of this was prompted by experiences that you've had. My second question was whether or not the Acton Water District has taken a look at these proposed changes and if they have had a chance to comment on them.
So I'll answer that, Ms. Nickel. These were brought for board deliberation. We haven't actually held a hearing on them yet. So the hearing will be coming up, at which point public comment is invited, including from the Acton Water District. Now, they're a fellow town department and we work closely with them. I can't tell you that they their attention has been drawn to looking at these changes because typically they wouldn't be impacted by them. But, certainly there's been communication between the health department and the water district routinely. Like I say, I can't tell you on this very specific case, but typically this would not impact the water district.
Okay, great. Thank you.
All right. Well, Cheryl, I believe, were you going to say there was anything else for the board's attention tonight, or?
There is not.
Dr. Bill, you have a duty to perform.
I'm unmuted, right?
Yes, you are.
Well, seeing that we've completed the agenda, I'll make a motion that for adjournment.
Very good. Motion is made to adjourn. Is there a second? Anyone? No?
Mike,
keep-
where are you?
I'll second it.
Very good. Mr. Cruz is seconded. We have a motion made and seconded to adjourn. If there's no further discussion, I'll take roll call. We'll go backwards. Mr. Conaby. How do you vote?
I hit the button.
Mr. Cruz.
Aye.
Ms. Becerra.
Aye.
Dr. Taylor.
Aye.
I also vote aye. We stand adjourned. Thank you all. I believe as Director York let us in on during her presentation, we're maybe starting to see some progress on the pandemic. So that's excellent news. I hope we continue to see that trend. And with that, we'll...
Me too.
Yeah, indeed. We'll conclude tonight's meeting and thank you again. Talk to you soon.
Good night, everybody.
All right.
Thank you.
Good night.
Have a good night.